Good evening, ladies and gentlemen. This is Dr. Paul, and welcome to our website at www.usmlavideos.net, where we have posted hundreds of videos. And you are always welcome to visit our website and browse through the videos as you prepare for your USMLE examination. Today, I want to talk a few minutes about Fanconi syndrome. Fanconi syndrome is a very commonly tested topic on USMLE, so I think that you need to know the very basics of this disease in order to do well. So that is the major interest of this lecture. First of all, let me describe the basis of this disease in layman's language. As all of you know, the kidney has one main function, that is reabsorption of the products that have been secreted into the tubules. So it has to reabsorb back into the system. When it fails to reabsorb those secreted products, those products are lost in urine. So whenever that reabsorption is defective, it results in Fanconi's syndrome. So Fanconi's syndrome is primarily the failure of the kidney to reabsorb the secreted products into the tubules. Now, what are the most commonly secreted substances? Glucose, proteins, phosphate, amino acids, magnesium, calcium, and bicarbonates. So those are the important products that have been eliminated in this syndrome. And before going further, I want to make this clear that Fanconi syndrome is totally different from Fanconi's anemia. So do not get confused between these two. Fanconi syndrome and Fanconi's anemia, they are totally different diseases, and I will spare Fanconi's anemia for a future discussion. But today, let us talk about Fanconi's syndrome. So in Fanconi's syndrome, these substances are lost: glycosuria, amino aciduria, phosphaturia. Even though other substances are being lost in this syndrome, for USMLE purposes, we need to remember GAP, GAP, glycosuria, amino aciduria, and phosphaturia, because they are the most commonly tested things in USMLE. Now, we have talked about the pathology. Now, causes. There are so many different causes. We can start with genetic diseases. We can also think about environmental problems, glycogen storage diseases, tyrosinemia, Wilson's disease, Lowe's syndrome, hereditary fructose intolerance, medullary cystic disease, vitamin D dependency, familial idiopathic Fanconi syndrome. Now, galactosemia, for example. Patient is not able to metabolize galactose. So galactose, it builds up, accumulates in the body and damages the kidney. So in these patients, how to find the cause? Just check for blood galactose levels. If the blood galactose level is high and the patient has Fanconi syndrome, the causative factor is galactosemia. And environmental assaults like heavy metals like cadmium, lead, mercury, platinum, uranium, they can also damage the tubules in the kidney. And outdated tetracycline and gentamicin, this is very, very important point. Outdated tetracycline and gentamicin, they can cause Fanconi's syndrome. Then amino acids like lysine, people who take lysine as a nutritional deficiency, they can get Fanconi syndrome because that amino acid has the potential in these patients to damage the kidney. Now, symptoms. You can actually predict the symptoms based on the pathology. The pathology is the defective reabsorption of the kidney. Kidney can't reabsorb the fluid. So what is happening? Water is going out without being reabsorbed. So these patients will have dehydration. These patients will have increased thirst, and proteins are being lost. What do you expect? Hypoproteinemia. And what results from that? Muscle deficiency. Calcium is being lost. Calcium is vital for bone functioning. So what symptoms do you expect? Bone weakness, bone pain. Bicarbonates are being lost. What do you expect? Acidosis within the body. So these patients will have acidosis. Magnesium is being lost. So hypomagnesemia can result. So those are the main things, and based on bone diseases, impaired reabsorption of calcium, we have further divided the disease into rickets and osteomalacia based on the age. In children, we call it rickets. In adults, we call it osteomalacia. Now, one important thing is, for example, if a patient has rickets usually or osteomalacia, we treat them with vitamin D. But in Fanconi syndrome, vitamin D is not useful because vitamin D's deficiency is not the problem. The problem is reabsorption. So you are not going to treat rickets and osteomalacia in Fanconi syndrome with vitamin D supplementation. That's important to remember. The next thing is diagnosis. Check for high level of metals in the blood like high lead, cadmium, uranium. Look for any metabolic diseases like galactosemia and genetic disorders or Wilson's disease or Low's disease. And now the prognosis is basically is good if you can treat the cause. If the patient has galactosemia, treat the galactosemia. If the patient has increased lead, treat the lead. So if the patient has a recent kidney transplant, just wait for a year. After 1 year, things will get better in patients who receive kidney transplants. Now, Fanconi's syndrome is again divided into two types, type 1 and type 2, based on the level of 125 dihydroxy D or 125 dihydroxy cholecalciferol. In type 1, 125 dihydroxy D is reduced, whereas in type 2 it is elevated. That difference also forms the basis for the difference in treatment. For example, in type 1, what do you do in the treatment? These patients have lost phosphate, so you give phosphate. These patients have lost bicarbonate, so you give bicarbonates. And these patients also have reduced 125 dihydroxy D, so you give them 125 dihydroxy D. But in type 2, you do not give them because 125 dihydroxy D is elevated in type 2. So in type 2, you just treat phosphate deficiency and bicarbonate deficiency. So I hope that will help you, and as always, visit our website at www.usmlevideos.net, and if I have missed anything, you're always welcome to post your own points on our blogs. Thank you. Have a good day.